Welcome to the deep dive. We're here to look closely at the source material you bring us and really pull out the key insights. So today you've given us something called Times Health Plus Plans and Acquisitions. Now, that title itself, it clearly points towards, business strategy, what a specific company, Times Health Plus, is planning, maybe who they're buying.
Right, and that's fascinating because, well, in any industry really, but maybe especially healthcare right now, a company's plans, their acquisitions, that's like a peek behind the curtain, isn't it? It shows you their game plan, their priorities, where they want to be in the market, how they see things playing out.
Absolutely. Yeah, it's the sort of source that could hold some really valuable clues about the future.
Yeah.
Now, just to be clear for this deep dive, we don't have the actual detailed excerpts of those plans or acquisitions in front of us. So what we'll do is focus our chat on what this type of source represents. What kind of critical insights you could expect if you did have that full text based just on the title provided.
Exactly. It's like
Yeah.
like looking at the title of a map, you know what kind of area it covers, generally, even if you can't see every single road or landmark just yet. And a title like Plans and Acquisitions, it strongly suggests some significant moves are happening or are planned.
Okay, so focusing on Times Health Plus then, and this idea of plans and acquisitions, what sorts of things would a source like this typically be detailing, especially in health right now? What drives these moves?
Well, in healthcare today, a lot of this activity, acquisitions, and plans, it's often about integration and expansion, of course. So you might expect to find, say, details about them buying smaller tech firms, maybe focus on telehealth or AI for diagnostics, patient data stuff, or it could be about plans to branch out, new services, maybe mental health or chronic care programs, even wellness, preventative care, perhaps.
Right. So it's not just about scale, like getting bigger, it's more strategic, building specific skills or reaching, new patient groups or markets. So let's imagine, hypothetically, if we saw Times Health Plus acquired a telehealth company, what would that signal?
That could really point to a big push for better patient access, more convenience, cutting down maybe on some in-person visits. It's often a reaction to how patients' expectations are changing. And it might be aiming for efficiency, maybe lower costs long-term. Even if it costs a lot up front, you'd want to look at what kind of telehealth they bought. Is it just like basic video calls or more advanced stuff, remote monitoring tools?
Okay, yeah, that gives a sense of the potential detail.
Yeah.
And the plans part of the title. How would the plans typically connect with these acquisitions?
The plans part. That's usually about the how they plan to actually weave those acquisitions into what they already do. That's really crucial. Just buying a company, well, that's only step one. The plans show how they'll use that new tech or service. So you might find stuff on like training staff, tech integration timelines, how they'll market the new offerings, or maybe expanding geographically using those new capabilities. It connects the dots.
Got it. So a source covering both plans and acquisitions gives you that whole story.
Yeah.
The big strategic move, the purchase, and then the roadmap for actually making it effective. It really underlines how linked these business strategy elements are in shaping, healthcare delivery itself.
Exactly. And if you think bigger picture, understanding these specific moves by players like Times Health Plus, it's vital for seeing where the whole health industry might be going. These decisions, that kind of hinted at by this title, they don't just live on spreadsheets. They directly shape, the services available to you, how you get care, maybe even the costs involved.
Yeah, and just knowing that a significant entity like Times Health Plus is actively working on major plans and acquisitions. It tells you the sector is definitely not static. It's changing, consolidating maybe, innovating certainly.
Which brings us to a final thought for you, the listener. Even though we couldn't get into the nitty-gritty text today, think about this type of source, Times Health Plus Plans and Acquisitions. If you are reading those details, what's the one key piece of information you'd hunt for? What would tell you the most about the future direction of healthcare? Think beyond just the deal itself. How could that specific plan or acquisition really change things like services, access, or cost for people on the ground? Something to ponder next time you see a headline about a health company's latest move.